General government. Oh, we're going to suspend. All right, we had to reboot some cameras. I apologize, but we're going to begin the general government FY24 walkthrough. Committee, if you'll go to page 1, section 4, Department of Audits and Accounts, section 4.1.1, 4.2.1, 4.4.1, we added the $2,000 COLA for all state employees for a total a little over $951,000. State Accounting Office, page 2, section 11, 11.2.3. Using a statewide spread, we were able to provide $4.5 million for this and last year's COLAs, unfunded portions of the past merit increases, and expenses related to the state financial and human capital management systems. You'll see the statewide adjustments to TeamWorks billings in just about every agency to account for this add. Georgia Tax Tribunal, page 5, section 12.10, 12.10.3, funds just under $17,000 were provided to for salary adjustments. Department of Banking and Finance, page 7, section 14, 14.3.4, $53,000 for annual expenses related to an initial investment of $505,798,000 in the FY23 budget to purchase software that will automate licensing processes. Department of Driver Services, page 8, section 21, 21.2.8, $2.3 million is added to address turnover in certain customer service centers. Office of Commissioner of Insurance, section 12, page 12, section 29, 29.3.6, $572,000 is included in the fire safety program for 2 arson investigators, 3 building inspectors, 3 elevator inspectors, and 3 manufactured housing inspectors. Now in section 29.6.5, you'll see $166,000 for $2,000 salary adjustment for the agency's law enforcement officials. This is the first place that you'll see across our budget throughout today that we're including $2,000 for all post-certified law enforcement agents. This is a total investment by the state of $13,244,126,000 that we're putting towards these law enforcement officers. Department of Natural Resources, page 15, section 24, 34.6.5. You'll see $770,000 for $2,000 salary adjustment for the agency's law enforcement officers, as we just spoke about. Section 34.7.4, we restored funds removed from the Georgia State Commission and provided an additional $55,000. 34.7.6, we added $100,000 for the Council for American Indian Concern. 34.9.4, we corrected an accounting error related to the Wildlife Endowment Trust Fund collections. Department of Revenue, page 18, section 42, 42.4.5, 42.8.5. You'll see $212,000 for $2,000 salary adjustment for the agency's law enforcement officers. Secretary of State, section page 21, section 43. 43.2.6, you'll see $550,000 was added for data plan contract related to poll pads. 43.3.5, $88,000 for $2,000 salary adjustment for the agency's law enforcement officers. 43.5.6, 43.5.7, the committee added $191,915,000 for 2 analysts and a full-time educator for the Georgia Board of Nursing, as well as $308,959 to provide 5 additional analysts to help with other licensing boards. 43.7.1 through 43.7.5, we added $584,055 to establish the State Election Board as a separate program within the agency. Georgia Access to Medical Cannabis Commission, page 22, section 43.8. 43.8.3, you'll see $422,000 for annual contracts related to the seed-to-sale tracking technology, laboratory testing, tech integration, and communication services. 43.8.4, you'll have $304,000 for operating expenses that expected to increase as the commission adds enforcement and regulation duties to its current licensing responsibilities. 43.8.5, $705,727 for 6 positions: an attorney, a business manager, a laboratory specialist, safety and compliance specialist, an inspector, and an investigator. It also includes salary adjustments for current employees. Professional engineers and land surveyors, page 22, 43.9. 43.9.2, we add just under $100,000 to funds recommended by the governor's office for positions to increase the total to $613,000. These funds will allow the board to hire an executive director, a deputy director, an executive director, IT manager, and customer service specialist. 43.9.4, we provided $280,000 for operation expenses, contracts, and rent. That is the portion of our budget. I'll stand for any questions. Hearing none, what's the pleasure of the committee? I hear a motion and a second. All in favor say aye. All opposed, like sign. Thank you. All right.
We're going to go ahead and call the Higher Education Subcommittee to order. We'll start to cover our section of the budget so we can keep on the schedule this morning. Our first section is section 41. This is under the Board of Regents. 4114. We're adding funds in. This is in the B budget, Ag Experiment Station, for personnel services for positions at the demonstration farm. We've continued to look at this. This is in Perry as we support and make sure this program continues to get online here. 4115, provide funds for 3 faculty positions for the peach and citrus industries. As you know, we passed a bill the other day creating the Citrus Commission. Part of this line item for the citrus breeders will help that commission in this emerging industry that, quite frankly, is taking off very well in Georgia and will do well for our ag community. The next one is a study for providing funds for vertical farming greenhouse planning study as we look at this sector of ag. There's a $100,000 ad there. Under the Cooperative Extension Service, we're providing funds. This is 4134, providing funds for 3 research technicians to support the peanut breeding and the extension team there. 4135. We're adding in money. We know we continue to support our county extension agents, and we've added $603,750 there. Next item, look under 4114.5. This is our public libraries. We're continually always to try to increase the funds for their materials, so we've added in 5 cents, raising it from 60 cents to 65 cents per capita there. That's an audit line item of $556,000 and some change. Next line, this is under the special services funding initiatives. We have several changes here. 4115.6. This is a request from the University of Georgia providing funds for the Center for International Trade and Security at the University of Georgia, providing for research assistants positions and postdoctorate publishing, printing. That ad is $487,637. Next item, 4115.7. We're increasing the funds here for the K-12 Rural Computer Science Pilot Program. This is in conjunction with Georgia Tech. I know that Chairman Jones has been working diligently on this project as we look to make sure we're trying to extend the science, the math and computing into our rural areas. So this is a special project there and we're excited about it. 4115.8, we're adding $90,000 to GISTIC, the Georgia Youth Science and Technology Center. They've been a vital partner in making sure that throughout rural Georgia we've got our STEM and helping our STEM teachers get into our classrooms in rural Georgia. 4115.9, we're increasing the line item that we added last year for Middle Georgia Aviation that is to support increased enrollment. This is $814,761. This is money that has been wisely spent. Return on investment has been great. Their enrollment is up 9%, and they're able to make sure they're whittling down a long waiting list. 4115.10, increase funds to expand the Archway Partnership. We're adding 5 additional communities there. These are very vital to our communities as they allow UGA programs and Georgia communities to connect with higher education to try to identify critically local identified needs and opportunities within our communities. 4115.11 is providing funds to support services and to address a backlog of projects at the Center for Rural Prosperity and Innovation, a $750,000 ad. Next line item, very important line item here. This is on 4121.4. We are providing funds for the Anne Frank Holy Cost Educational Center. It's here in Sandy Springs. This was one of the only commission that I'm aware of that the state had not funded thus far, and this is a very, very important project. Those who do not know history are bound to repeat it, and this is in conjunction with a lot of support from the locals within Sandy Springs who have been propping up this commission for a while, and a new building's about to come online, and we want to make sure this project is properly funded. And that's an add of $344,500. Line 4411, this is additional money. Chairman Martin, the bill that we've gotten out of his higher ed committee, this is in regards to the college completion grants. And the passage of House Bill 429, we're adding an additional $10 million to this program, bringing it up to $20 million. Very important. We're going to make sure that those who need it can absolutely get to the point where they're about to finish this degree. We want to make sure that they have the resources to finish these degrees and make sure they get across the finish line. Next line item is the Georgia Student Finance Commission. This is line item 4426. We've talked about this before. This commission under Lynn Riley's done a great job. We continue to put more and more programs up under her. They're doing a great job, but they are desperately in need of funds to make sure that they are properly staffed to carry out these programs. And what we're basically doing here is telling them we want to make sure there's language that authorizes them to use some existing funds, and that amount is $1,622,000. They're doing a great job, and I think it's a key part of education and making sure that we have our programs administered correctly, but it's also the data that we need as we look at higher education across Georgia. 4431, this is dual enrollment. We're simply here, we found savings of $6,595,000 and some change, and this is based on projections. So we're making sure we're trying to get back to what we projected it to be, and as you know, we always can come in and make sure we true it up in the amended budget if it is different than the projections. This is the next line is 4441, the engineering scholarship. And we are simply making sure that we're recognizing the funds for this scholarship, very important scholarship at Mercer University. As many of you who were in the committee, we heard testimony. This engineering program was specifically we asked Mercer years and years ago to develop this program, and it is a major foundation of the support for the engineers that are needed at Robins Air Force Base. Currently, they could use a couple of hundred more engineers, but Mercer has been the foundation of making sure that they have a steady flow of engineers coming out that are supporting Robins Air Force Base. Next is the HOPE grant. There are some savings there that we're realizing, and we're actually increasing the funds to meet the projected need of these programs at a factor rate of 95%. But there are some programs that say they don't need anymore. In other words, there's a couple of their high cost programs that tell us that they have currently what they need, but we're also looking at additional money up under here for $250 for the CDL career grant that would help cover the students out-of-pocket cost. Next line, HOPE scholarships, private schools. Here we are increasing and putting a line item to hopefully bring a modest increase back to the private school, the HOPE scholarships for private schools. This line item add of $15,370,000 would bring the private sale award up from $2,977 to $3,100, and at a 95% factor rate, it would increase the HOPE from $2,282 to $2,945. HOPE scholarships, public schools. Here, and this is where we got some of the savings from. We're continuing to make sure that we're going to increase the factor rate. You know, we did this last year. Again, the factor rate is what the HOPE is paying to our students. Again, if you're a Zell Scholar, it's paying 100%. But if you're a regular HOPE, it pays a certain percentage of the cost for the prior year. And again, we're increasing this. I think it's 92% last year. This year we're going to do 95%. And I know the governor had put in a higher amount, but we're going to take and do 95%, which is still a big increase. And that's where we're getting some of our money to offset for some of the other projects, including some holes in the state health benefit plan for pre-K. Line item 4411, this is IPSI. This is inclusive post-secondary education grant. We're adding in almost $1 million there, $955,000. Currently 143 students across 9 institutions throughout the state. Next, service cancelable loans. We're just sitting here utilizing, this is funds to support the Georgia Military College. This is 44172. We're language to support them using existing funds, 100,000. 4417. This is a $20,000 loan and payment over 5 years for the peace officers. This was the legislation that came out of Chairman Martin's committee as we were trying to recruit and retain new law enforcement officers across the state. 4417-4, this is money put in for the loan repayment over 5 years, and this is for the medical examiner loan repayment program. We've got budget language 4417-5. And this provides that we're using existing service cancelable loans in the degree programs. You know, it has been our priority with mental health as we pursue health professionals in this area, and we're putting in language to use existing funds. It was funded in prior year, and we're still waiting on the district to implement the program. Tuition equalization grants. We're looking at, there are currently over 4 million reserves, and what we're looking at here is actually we found savings, but that's because there are reserves, and we're telling them to use the reserves. In the end, this is actually going to increase $50 per hour for these awards. Ultimately, we're going from $900 to $1,000 per year on the tuition equalization grants. Next line, Technical College System of Georgia, 4651. Chairman Parrish, this was a great program that he had suggested. This is a quick start style program from the technical college where they're going to end up having some healthcare based employees who will help with the startup. This help will start up in cost and consultant cost, but what this program will do will be to go out, especially as we have new physicians open up offices in rural areas. This program is a smaller version of a quick start to make sure that those physicians can go in, and they're going to train those folks within the office, the folks who are doing the billing and the scheduling, so that we can make sure that these physicians are up and going very quickly. A great program suggestion by Chairman Parrish. 4467. We are implementing the first of a 3-year phase-in for increased credit hour earnings. This is for three of the highest cost programs within the technical college system. These programs are nursing, commercial driver's license, the CDL, and the aviation. Very important that we support our technical colleges. As we've spoken in this committee, we need to look at making sure that we're funding them properly according to the cost of these programs that are helping develop it and make sure we have the correct workforce out there. 4668 is the next one. This is $1,011,000 for a Tools for Success matching program. This is to assist the graduates of these programs as they leave and go to work. A great program that has matching money from foundations. So with that, committee, that is our budget, and if there are any questions, we'll be happy to take any. If not, I will hear from the committee on any motions. Have a move? Have a second? All right, any other discussions? All those in favor, please say aye. All those opposed, same sign. And it passes. Thank you, committee. We are adjourned.
Okay, the Transportation Subcommittee of Appropriations, I will call to order. If we could close that door in the back and let's get started. Thank you, Mr. Chairman. Okay, as we're going through the transportation budget, it's in section 47 for my committee members. So while we would always love to see additional monies, I think transportation is one of the key areas of the state. Infrastructure, moving goods and people around. We'd always love to see additional funding. What we're looking at is how we spread the money around in the state in transportation and be as efficient and effective as we possibly can. The first change that we have is 47.1.1. In airport aid, we reduced airport aid by $6.4 million. If you will recall, committee members, we did have an add of 18.2 to blunt somewhat this cut in the amended 23. And 47.2.3, we redistributed $13 million. Partially to take care of some of the inflationary effects on capital maintenance and routine maintenance projects, and also to fund the COLA, and you'll see that throughout. And 47.2.4, we increased by decreasing in capital construction projects $20 million that will be flowing to LMIG to increase the LMIG program to 11% from the current 10%. At 47.3.2 is where the $5 million of the 13 that we just redirected will go to increase capital maintenance projects because of inflationary challenges that we have. So we're going to see a true up in a couple of spots here. At 47.4.1 is a COLA true up, as well as 47.5.1. 47.5.2 is another true up. It's a TeamWorks true up. 47.6.2 is where we increased LMIG. That's one of the most popular programs for our local people in taking care of local city and county roads. We added the $20 million that we pulled from capital construction here for LMIG. 47.8.1 is a true up. 47.8.3 in the planning department, we added 3 positions here. It's not a big number, 133. However, that's because it's a 20-80 match, 20 state, 80 federal. This is for Atlanta area planner, emerging metro planner, and financial planning. In the planning department. And 47.10.1, another true up for COLA, as well as 47.11.1. There is a change here at 47.11.5. This is funding for a problem we have with stopping traffic in the Henry County, so we're looking at a sidetrack innovative plan in Henry County that is $2.4 million, which is 40%, our half of the 40% of the cost. In 47.11.6, there was addition of $162,000 due to that figure was not broken out of the amended 23 when the intermodal was broken out, so we needed to add that for safety oversight in the rail program. 47.12.1, another true up. 47.12.3 is the $5.5 million add in routine maintenance because of inflationary pressures. And then we have a true up at 47.13.1, the COLA true up that we've mentioned before. That is the changes we had in the from the governor's recommendation, and I'll listen to questions or ask for a motion. I've got a do pass, and I have a second. All in favor, aye. Aye. Opposed, no. Motion carries. We stand adjourned. Thank you.
Good morning and welcome. Good morning, welcome. It's good to see all of y'all bright and early. It is kind of special to walk in the Capitol when hardly anybody's here, isn't it? It's kind of a privilege, actually, to do that. It takes my breath away still to this day when I get to do that. So we're here to talk about the human resources budget. And before we do, I want to tell y'all that if I told y'all the asks, the number of asks, or the dollar amount, you probably might not believe me. It was massive. So I want to thank the committee. I want to thank Amber. I want to thank our House Budget Office and Chairman Hatchett. There's been a lot of work to meet many very, very important needs. Every ask was important and worthy. No doubt we could not meet them all at this time, and we have left some great opportunity for our partners in the Senate to come in and help us do more. Our first change is at 15.2.2. And this is just a name change. It's in the language, Adult Developmental Disability Services will change to in the Service Project Program to Adult Developmental Disabilities Respite Service Program. The House agreed with this. The next change will come at 15.3.6. This will be a measure that I'm going to tell you a little more about in just a minute, but this will be a breakout of the hospital staff raise for $1,112,791,000. So our next change comes at 15.3.7. 15.3.8. This will increase funds to annualize the cost of the new options waivers now and the comprehensive supports waiver program COMP for slots for individuals with intellectual and developmental disabilities. This is $10,950,021. In the budget, the administration costs were not there, so as the House, we added that. 15.3.9. This will increase funds for 375 additional slots in both waiver programs for individuals with developmental disabilities and provide administrative workload supports as well. This will include half a year of the cost for an additional 125 waivers. Very respectfully, I want you to know that 2,400 was the number asked for. That would cost $66 million. At this point, we're going to continue to work on it with this addition of $8,056,825. The next change comes at 15.3.10 to begin implementation for the 22-23 provider rate study pending approval by the Centers for Medicaid and Medicare Services, CMS. We are saying yes to this. We are encouraging it. It is a very expensive but very important undertaking to understand the next steps. Next, at 15.3.11, this will increase funds for citizens advocacy to restore previous cuts and expand the service. It matches people with IDD to advocates that help with finding resources, housing, employment, and other services. There are 5 offices that are reflected here in Savannah, Athens, Atlanta, DeKalb, Milledgeville, and Macon. This will be for an addition of $200,000. Next, under Adult Forensic Services, 15.4.2 will increase funds for 5 forensic evaluators and 4 forensic peer mentors, $1,218,343,000. This is less than the original ask, but as I said, we are leaving some very special work ahead. At 15.4.3, we'll provide funds to increase salaries for the forensic mentors, $277,027. This will raise the pay of the current and new mentors by 10% to change that from an average of $40,000 to $44,000. Next, at 15.4.4, will be another one of the hospital raises at $4,376,950,000. Under Adult Mental Health Services, 15.5.6, to annualize the operating cost of the 24-bed and 16 temporary observation chair health crisis centers at Serenity Behavioral Health Systems in Augusta. This will be $7,030,171. This funding at full service and staff enhanced model will ensure comprehensive services are being provided. This will give the full rate and will include the staff enhancement to ensure patient needs are thoroughly met. Next, at 15.5.7, will be for funding for a 15-bed, 18 temporary observation chair behavioral health crisis center in Fulton County, a long-awaited project, very important to this area. At this point, it is an addition of $6,651,470,000. This will add half of the $13.3 million needed for renovation of the existing building. The full $13.3 will be needed in the 25 budget. Next, at 15.5.8, we'll increase funds to create a crisis stabilization unit at CSB of Middle Georgia in Dublin to a 24-bed and 16 temporary observation chair behavioral health crisis center. $10,823,084. This is the same for the full funding service as well as the staff enhancement to ensure patient needs are thoroughly met. Next, at 15.5.11, will be to increase the funds for additional program and administrative support to manage the very important National 988 hotline. This will be $2,251,420,000. Next, at 15.5.12, this will increase funds to convert a crisis stabilization unit at Highland Rivers to a 32-bed and 16 temporary observation chair behavioral crisis center at $4,558,493,000. It includes staff enhancement and the comprehensive services that are necessary. 15.5.13 will increase funds for the Georgia Housing Voucher Program to support the requirements of the Department of Justice ongoing settlement agreement at $1,902,500,000. This will fund about 250 slots at $7,610 per slot. Next, 15.5.14, which will increase the funds for the Georgia Mental Health Consumer Network Peer Services at $2,774,013,000. This will restore cuts that had been supported by federal funds, which have since expired. Next, 15.5.15, which will provide funds to increase salaries for our state psychiatric hospital staff to address agency recruitment retention. I've mentioned those hospital raises as we have gone through here. To further explain that, this will be an add of $2,735,431. This will bring the staff to a 20% market rate. This will include payment for nurses, non-clinical direct care, tax aid, administration, and other employees. Next is 15.5.16, which will provide funds to support private psychiatric contract beds at $8,066,106,000. This annualizes $2 million provided in the 23 budget. 15.5.17, which will increase funds for one-time funding to coordinate outreach to address homelessness in the Atlanta area. This will be $825,000 to fund 10 outreach workers to connect homeless people to needed referrals. 15.5.18 will provide funds to create a crisis response team at Viewpoint Health Lawrenceville Outpatient Center, $277,519,000. The funds, this will fund half of the request. Viewpoint has a CSU but no crisis team to serve Gwinnett, Rockdale, or Newton counties. Our next comes at 15.8.2, which is another one of those hospital raises that we have talked about. It's $69,190,000. 15.9.2, the department is directed to work with the Department of Community Health to increase Medicaid PRTF rates up to 75% of Medicare inpatient facility rates, contingent upon Centers for Medicaid and Medicare approval and agreement by facilities to follow DCH-defined payment policies that prioritize Georgia's youth placement. There is no money, but this is to ensure at this time and to encourage that adequate beds are available for Georgia's youth. The next change you will see is at 15.9.3 to provide one-time gap funding for Georgia's psychiatric residential treatment facilities receiving less than $500 per patient per day while under current cost report reimbursement methodology. This will be for $600,000 to assure adequate beds are there for Georgia's youth. The next is at 15.9.4 to reduce funds for delayed contract implementation. This was a savings of $100,000 because the contract has not been implemented. Next, at 15.9.5, will be to provide funds for the multi-agency treatment children match teams to support collaboration across state agencies to meet the treatment needs of children. This is for $1 million. This was established in House Bill 1013, but not funded at that time. Next, at 15.9.6, is language to encourage the utilization of funds in the Adult Mental Health Program for mobile crisis for children and family response. This will encourage DBHDD to use funds for children and specific needs. Throughout the conversations, we have heard the great increasing needs for children and youth throughout our state for mental health services, and particularly for some that are immediate and impactful. Next, at 15.9.7, this is another hospital raise at $6,162. In administration, 15.10.5 will provide funds to support operations and personnel for the administration of the federal opioid settlement funds. This will fund the coordinator and temporary legal personnel at $300,000. 15.10.6 to increase funds to support agency operations at $650,000. The new administration is without several positions, including communications director, community engagement, IDD data personnel, and several others. So this will help them. Next, at 15.11.4 will be another hospital raise at $1,844,751. And then at 15.13.2 will be to provide funds to expand the inclusive post-secondary education program, IPSE, at $200,000. There's a need for someone to help manage the program data. The new program includes several possible sites and other administration needs. We are hopeful that the Senate will come in and help us increase this very important program. And that is behavioral health. Next, we can look at Department of Human Services, starting at Section 28. 28.2.5 will provide funds to expand services for at-risk girls, $400,000. This is for Pace Center for Girls, which received $250,000 in the FY23 budget. The services are in Macon, Bibb, Peach, and Peach counties. Next will be at 28.4.5 to increase funds for the Court-Appointed Special Advocates CASA program to enhance statewide capacity of $1 million. This sustains the current activities and expands their growth throughout all of our counties. 28.6.6 will provide funds to operate the Georgia Commission for the Deaf and Hard of Hearing at $20,000. This was cut under GVRA due to a delayed contract. The Department of Human Services has agreed to manage this money and to help this very important program. The next is at 28.7.4 to increase funds for the long-term care ombudsman program at $295,000. This is also a measure that we hope our Senate partners will help us increase. This funds half of their request. Ombudsman representatives are throughout our state. Their pay increase is needed at about $10,000. The $5,000 is also in additional expenses for the program to help them deal with many of the facilities across our state that serve our elder population. The next is at 28.8.4 to increase respite funds for those with Alzheimer's disease and related dementia of $1 million. These funds flow through the area agencies on aging. Next at 28.8.5 to provide funds for non-Medicaid home and community-based services at $5,464,800,000. This funds nearly 2,500 slots, which provide services that help seniors remain in their homes. It includes delivered meals and day services. The current number of people in the queue waiting for these services is 9,600. The next change is 28.11.5 to increase funds for 300 additional Medicaid eligibility caseworkers to process Medicaid redetermination cases due to the public health emergency expiration, the unwinding that is ahead. This is $11,047,676,000. This is a difference because there was an assumption that hiring would take place in 3-month staggered terms, but is an immediate need. Next is at 28.12.2 to provide alternative housing options for youth with complex need. While there is no money attached to this, we are telling the department that it is very important that this be addressed right now. Next is at 28.13.1 to reduce funds for non-programmatic expenditures. $4 million was appropriated for United Way in the 23 budget. $500,000 was set aside for evaluation, and we would prefer that that fund all programming. So this is a reduction of $500,000. Next, at 28.18, the Council of Aging, 28.18.3, to provide funds to help them meet their technology needs of $20,000. Co-Age particularly contracts services for a production company to provide virtual and hybrid meetings for their members across the state, and this will help with that. And next at 28.24.6, this will increase the funds for the Georgia Radio Reading Service, $128,150,000. This was funded in the 23 budget. Their costs are rising, and this will help so much. This is a service that particularly addresses the needs of our blind. It's a visual reading service that is current and up to date on many of the media services throughout our state and our nation. Next, at 28.24.7, will increase funds for vocational services at, let me make sure I have the number right going across the line, $200,000. 28.24.8 will increase funds for independent living centers at $300,000. This is for the Centers of Independent Living statewide, or Independent Living Council. There are a few gaps still left across our states. This will help fund one new site, and they will provide housing policy coordinator to assist people in finding safe and discriminatory-free housing. The potential sites include Lawrence, Coffee, and Dodge to serve South Central Georgia. And I believe one more department, that is the Department of Veterans Services. So at 48.2.1 will increase funds to provide $2,000 cost of living adjustment for full-time benefit eligible state employees effective July 1. This will help address agency recruitment and retention, $53,989. This is a true-up. Next, at 48.2.2, we're asking them to utilize $1 million to establish a veteran cemetery in Augusta. This is an important measure that we've been working on for a while, but they have not received their grant from the federal government yet. So the next round of the VA grant consideration is in October. The Department of Vets will apply this spring, and then we will see about getting that cemetery. The next is at 48.3.2 to provide state matching funds to draw federal funds from the United States Departments of Veterans Affairs and support recruitment for the retention of the subacute therapy unit at the Georgia War Veterans Home in Milledgeville, administered by Pruitt Health. This is an ad for $250,000 with their federal money. That will double. And I believe our last one is at 48.4.1. This is also a true-up to increase those funds for a COLA for full-time benefit eligible employees and help recruitment and retention at $389,472,000. That is the work we were able to do. There is no doubt much more left for us to come back and work on. Are there any questions? If not, I will entertain a motion. A motion and a second has been offered. All in favor, please signify by aye. Others by like sign in opposition. We have passed this portion of the state budget, and I thank you all.
Good morning, ladies and gentlemen. I will be presenting the budget for the healthcare. I appreciate everyone being here. Just a few opening words. We've noticed, as everyone in the state has, that there's need for more medical providers of every type. And we need to increase rates, and we need to provide more doctors and medical care in our state. We've put a lot of emphasis on that issue in our budget. And I will begin with 17.4.3. That will reduce funds for the Rural Hospital Stabilization Grant in anticipation of the new hospital direct payment program, and that is for $3 million. 17.4.4, elimination of a one-time startup for federally qualified health centers, $500,000. 17.4.5 is to provide funds for 3 federally qualified health center startup grants for primary care in Union County, behavioral health expansion in Augusta, and a second school-based health center in Emmanuel County, $750,000. 17.4.6 provides funds for a charity clinic statewide, $250,000. This is half of the request. Additional funds to expand services is needed to meet the demands of increasing patient numbers. 17.4.7 provides funds to Mercy Care Atlanta to support increased patient volume, $500,000. This is a result of the closing of the AMC Atlanta Hospital. 17.4.8 funds provided to support existing new housing for the Area Health Education Center, AHEC. That's $409,000. It supports increased rental costs for existing housing, as well as housing to meet increased demands. 17.4.9 provides one-time funds for Colquitt Regional Medical Center for medical education training equipment and clinical space. That's $1,237,910. This is half of their request. This is a rural hospital that has taken on setting up their own residency program, and they're coordinating with Emory to have a special surgical center. They also will be expanding in the psychiatric residency program. 17.4.10 provides a one-time funds for St. Francis Hospital to support graduate medical education facility expansion, $425,000, funding residents, workstations, and sleep accommodation space expansion. 17.4.11 provides funds for Archbold Medical Center and infrastructure support for residency programs, $1,097,538. This facility is providing clinical education space for residents, their preceptors, and faculty office space. They're in their second year of residency, again, a rural hospital that has stepped up to provide their own. We'll move on to 17.5.2, provides funds to implement and regulate new licensure category for adult residential mental health programs. It was established in HB 1069, and this can't happen until we fund it. 17.7.1, increase funds for growth in Medicaid based on projected utilization. This reduced funds of $32,365,351. It's just a fund reduction. We will be reevaluating that. 17.7.10 provides funds for adult coverage for dental services, $1,390,850, and this is to allow dental services to those on Medicaid and currently do not have that coverage. Medicaid services were limited, and this will expand it. 17.7.11 provides funds for 5% increase to emergency medical services, that's EMS reimbursement rates. This is going to be spread to other Medicare programs. We have several buckets that we actually spend dollars out of. They're low-income Medicaid, ABD, and those for children Medicaid. So some of these will be repeated in other places. 17.7.12 provides a 2% rate increase for home community-based service providers. That's $5,255,948. Again, additional support for workforce. 17.7.13 provides a 5% rate increase for Georgia Pediatric Program, that's GAPP providers. That's $854,167. GAP provides in-home nursing care for more than 1,700 medically fragile children across the state. 17.7.14 provides funds to increase dispensing fees to $11.50 for low-volume pharmacies that fill under 65,000 prescriptions each year. That will be $308,666. 17.7.15 provides funds to increase reimbursement rates for speech, language, pathology, audiology, physical therapy, and occupational therapy. That'll be $2,195,707. This spreads with other Medicaid programs also. 17.7.16 submit a state plan amendment to adjust psychiatric residency programs, and that is the PFTF rates, 75% of Medicare inpatient facility rates, contingent upon the CMS approval of agreement by facilities to follow Department of Community Health defined payment policies that prioritize Georgia youth for placement. And that's wording that will be in the budget. 17.8.8 provides funds to reimburse the family psychological and therapy services. That's $871,029. There are 4 codes that will be added for family therapy, diagnostic evaluations that have not been funded prior. 17.8.9 provides funds to remove the 5-year waiting period for pregnant women and children who are lawful permanent residents. That's $584,061. States have already waived this 5-year waiting period, and we will become part of those. 17.8.12 provide funds to increase select primary care and OB/GYN codes to the 2021 Medicare level. That's $18,781,846. It's raising primary codes across the levels. Thank you. 17.8.13, the department shall require Medicaid programs organizations to reimburse at no less than 100% for durable medical equipment. This is wording only. It does not have a dollar value, but our CMOs have not been reimbursing at the actual cost of durable medical equipment. 17.10.1, it reflects nothing in the budget dollar-wise, but it reflects a $500 increase in employer contributions for the state non-certified employees phased in over 2 years. 17.10.3, it is the intent of the General Assembly that the department shall make annual recommendations to adjust state health benefit plans for the employee contributions, something the state the department has not been doing that. We feel like they need to review it each year so we don't wait several years where there's a large shortage. Again, that is wording into the budget. It does not have a dollar value. 17.12.2, increase funds for 102 new residency slots in primary care medicine. Increase funds for 116 new residency slots in primary, and 17.12.2, increase funds, and that is going to be $2,014,498. 17.12.4, transfer funds from the Georgia Board of Health Work for Morehouse School of Medicine grant program for 9 psychiatric residency slots and provide funds for 1 additional psychiatric resident position. That's $153,352. 17.12.5, transfer funds from the Georgia Board of Healthcare Work Morehouse School of Medicine grant program for child and adolescent psychiatric fellowship positions, $240,000. 17.12.6, eliminate one-time funds for statewide dental workforce assignment. It's $35,000 that was done last year and is being removed. 17.12.7 provides funds for 6 child and adolescent psychiatric fellowships at the Medical College of Georgia, $648,507, 2 slots per year for 3 years for training pediatric residents. This program started in 2020 and has completely filled up. 17.12.8 provides funds for a maternal fetal medicine fellowship at the Medical College of Georgia, $150,000. The program would be 1 fellow per year for 3 years. There's a national shortage of these providers, and Medical College of Georgia is focusing on students who are staying in Georgia. Moving on to 17.14.3, provide funds to support the startup of a new OBGYN graduate medical education program to address maternal care deserts in rural Georgia, $240,000. It will start the cohorts in 2 residents in 2024 with the goal of expanding to 5 per year. 17.14.4, provide funds to support the increase of the Morehouse School of Medicine class and size, expand rural clinical training, $1,500,000, expanding first-year class to 225 students with the next 5 years by adding 15 to 25 students each year and establishing a rural site in Albany. 17.15.2 provides funds to establish the medical examiner loan repayment program. It's going to reflect in the Georgia Student Finance Commission. That's why there's no dollar. It's been moved to another area. 17.15.3, increase funds for the physician's loan payment to increase award amounts and update the dates. The increased funds to the Rural Physician Loan Repayment Program to increase awards and amounts. Funding 6 additional physicians, 54 total, and raising annual repayment from $25,000 to $50,000. That's $1,560,000. 17.16.1, provide funds to establish the Nursing Faculty Loan Repayment Program. That's $500,000, $10,000 for 50 nurses for faculty annually. 17.16.2, provide funds to Georgia medical student capitation payment to the Philadelphia College of Osteopathic Medicine, $636,341. This is an additional 100 slots, and it is spread between their South Georgia facility and their one in Swanee. 17.17.3, provide funds to personal services to support increased licensure application volume, $314,373, 2 licensing techs, and 1 deputy director general counsel in order to support 60% increase in application volume over the last 3 years. 17.18.4, increase funds to provide a $2,000 salary adjustment for law enforcement officers to reduce turnover and increase retention. That's $45,360. Okay, we're moving on to public health, and that will be first will be 38.1.2, provide funds for the Sickle Cell Foundation, $363,675. They are providing a mobile hematology and unit staffing and upgrades, additional staffing support for the community health workers. And 38.1.3, provide funds for pregnancy and parenting grant programs, $500,000. That will bring the total amount to $2.5 million. 38.1.4, provide funds for the Georgia Council of Lupus Education and Awareness to support research, data collection, awareness, and education. That's $50,000. We have 28.4.3, reduce funds for the Georgia Coordinating Center to reflect project expenditures. That's $2,300,000. 38.5.2, provide funds for the Georgia Poison Center. There's an expectation of a shortfall in the 2024 due to loss of federal funding. We are funding $250,000 of that. 38.7.3, provide funds for a pilot to provide home visiting at-risk and underserved rural communities during pregnancy and early childhood to improve birth outcomes, reduce preterm deliveries, and decrease infant and mother's mortality. That will be $1,689,000. Initial startup funding for 2 pilots in 2 districts for a multi-agency coordination of services. 38.7.4, provide funds to increase reimbursement rates for speech, language, pathology, audio, physical therapy, occupational therapy providers in the Babies Can't Wait program. That will be $402,421. Babies Can't Wait positions in additional to Medicaid reimbursements. 38.11.3 removes one-time funds provided by the General Assembly for infrastructure and support disregarded in the general budget as add-ins, and that's $1,700,000. That concludes my budget. Are there any questions? If there are no questions, I will entertain a motion. We have a motion and a second. All those in favor say aye. Thank you very much, ladies and gentlemen. The budget has passed.
If everybody will have a seat, we'll try to get started. Am I on? If everybody will have a seat, we'll try to get started. We're running a little late. Does everybody have a tracking sheet that needs a tracking sheet? Thank you.
We're good.
Okay.
We're good. Are you good?
I'm fine. We'll start, this is economic development, and we'll start with the Department of Agriculture, section 13, if you have a large tracking sheet or just a small one. Section 13, Athens Tifton Veterinary Labs. Provide funds for planning a new veterinary lab in Athens, $100,000. They already have some other sources of money. So this is just to help them a little bit. I'm not going to make comments on all of these, but I just knew that you'd probably see $100,000 and wonder how you could make a planning with that one. Reduce funds, 13.1.3, reduce funds, replace funds for 2 veterinary lab technicians at the TIF Veterinary Diagnostic Center, $150,000. The next change is 13.2.5, provide funds to implement the Georgia Raw Dairy Act that we passed in 2022 session. 13.2.7, provide funds for the state agricultural response team, $340,000. 13.2.8, provide funds for 2 compliance specialist positions, equipment and vehicles to administer and enforce soil amendment rules, $550,000. The next page, we will have, and by the way, as you've been told, I'm not calling out all the statewide things that are throughout the budget. I'm just calling because we have them all through the budget on statewide things. The first one is, okay. The next one, that takes care of Department of Agriculture. Next, we will go to Department of Community Affairs, section 16. $16.9.1, provide funds for home access program to increase the number of award grants to individuals requiring home accessible modification, $200,000. I hope the Senate can put some more in that. The next one is 16.10.5, reduce one-time funds. This is in state community development programs, $45,000. These are some funds that were left over. Still in Department of Community Affairs, provide funds for Helping Hands Hungry program, expand to increase access to food, reduce food waste, and encourage better educational outcomes and sustainability. That was 16.10.6 and $200,000. I hope we can get the Senate to put some more in that. 16.10.7, provide funds to enhance services at McIntosh County, $250,000. The next change in the budget is 16.12.1, Georgia Environmental Finance Authority, reduce one-time funds, $316,427. The next change is 16.12.2, provide funds for Metro North Georgia Water Planning District for ongoing planning and technical assistance, $100,000. The next 16.14 fund, Community Affairs, reduced funds for grants, $39,555,757. And this leaves them in, how much will they have left in that department?
$5 million in the base.
The base, they'll still have their base. $13.7.3, reduce funds for international contracts, $200,000. The next change is 23.10.6, eliminate one-time funds for the Martin Luther King Center for Nonviolence of Social Change for facilities improvement. And we said to use the $475,000 in existing funds for grounds and exhibits, and that gives them a total in their budget to do that with the other existing funds of $740,000.
One more.
And then the last one is increased funds for Georgia Historical Society to maintain the markers, $70,000. Georgia Forestry. Throughout the forestry budget, you will see that we're providing funds for retention and recruitment, and it reflects in all programs. The first program I just mentioned is administration, $245,000, and you'll see in all programs that's listed. The next we have Public Service Commission. There's just one slight change in Public Service Commission to provide funds for security, $47,840. Do I have any questions? Do I hear a motion to pass?
I make that motion.
Do I hear a second?
Second.
All in favor say yes.
Yes.
Thank you, and thank y'all for all y'all's hard work. I know we met a lot of times, and thank y'all for your input.
Thank you, Madam Chairman.
Okay, I'm last, so I'm going to try and run through this pretty quick, but I'd like to call this meeting of the Public Safety Subcommittee on appropriations to order and begin with the Georgia Court of Appeals. Under Section 5.1.5, increased funds to provide a 3% salary adjustment for recruitment and retention of all court appeals employees. It looks here they asked for $504,000. We gave them $159,000. What we did was we incorporated the 2% $2,000 pay raise everybody's getting into that 3%, and we didn't give it to the staff personnel. We just gave it to the attorneys because that's where the shortage is. Under 5.1.9, provide funds to upgrade the Court of Appeals docket system. They asked for $900,000. We didn't give them anything because we fully funded it in the supplemental appropriations already. Judicial Council, there are no changes. Juvenile courts. Grants to county for juvenile court judges. Increased funds to grants for counties for Blue Ridge Judicial Circuit. They asked for $25,000. We didn't give them anything, and the reason for that is they only have 4 judges, not 5, so they didn't qualify for the $25,000 per formula 5th judge increase. Conflict case under prosecuting attorneys. Provide funds for personal services and operating expenses to establish the new conflict case program. What happened here is we've moved the conflict cases from the Attorney General's office to the prosecuting attorneys. And just a short informational bit, conflict cases are when typically we get a new district attorney, and he's been a defense attorney. He can't prosecute those cases that he represented previously, so the Prosecuting Attorneys Council has to put somebody in there to prosecute it. It's pretty substantial. It's going to be $1,801,727 to provide for that. There are over 500 cases pending. District attorneys, 8.4.4, increased funds for one-step increase for assistant district attorneys to support recruitment and retention efforts. They asked for $2,050,815. We gave them $1,554,004. It looks like a decrease, but once again, we incorporated that $2,000 COLA that everybody's getting into the process, so they got their 3%. $8.5.8 to 8.5.11. These are all about the conflict cases. We consolidated them all into one position, so we didn't fund any of that. It's funded in the other area. Superior Court judges. 9.3.9, provide funds for creation of one additional judgeship, and this is in 3 different areas. The Daugherty County Circuit, the Coweta County Circuit, and Atlantic Circuit all got an extra new judge. They begin 1st of January 24, so we funded them for a half a year. It's $214,000 apiece. Supreme Court of Georgia, 10.1.9, increased funds for one floating staff attorney position. This is to provide for when they have people on military leave, maternal leave, sick leave, that they have somebody to stand in for them. 10.1.10, increased funds for one central staff attorney position. They got an extreme backlog at the central office. They asked for $216,000. We gave them $219,000 because we incorporated the COLA into it. 10.1.11, increased funds provide a 3% salary adjustment for law clerks and for retention purposes. We did the same thing here we did with the others with the 3%. They asked for $170,000, we gave them $79,000, but they got their 3%. 10.1.13, provide funds to upgrade the Supreme Court docket system. They asked for $832,000. We didn't give them anything because we fully funded it in the amended budget. Moving on to community supervision, and you'll see this throughout throughout the rest of the budget presentation. Under 18.1.5, increased funds provide for a $2,000 salary adjustment for law enforcement officers to reduce turnover and increase retention. Throughout all the law enforcement areas in the rest of the budget. They're all going to get a $2,000 annual increase, in addition to the $2,000 COLA. Moving down to 8.2.5, this is the same thing for those in field services, $5,168,616. 18.3.5, it's the same thing once again, $6,782. And then down to 18.4.5, once again, it's the same thing in that area, $10,174. Moving on to corrections. You'll see a lot of information in the corrections budget here, which talks about transferring funds for a new budget. Somebody at OPB decided to change our budget all around, and they transferred all the funds that are incorporated in their prior budget into new areas, and that's all been changed back, so we're going to disregard all that. It's back like it was. County jail subsidies, 19.2.1, transfer funds to the offender management program and eliminate the county jail subsidy. We've already done that. It's not a problem. We returned $5,000 to the state treasury. The holdup is I keep seeing these things where it's transfer of funds that I'm not going to speak to. So. $19.9.8 under offender management, provide funds for a $3 per diem increase for county correctional institutions. These are the county institutions that typically state prisoners are in, and it costs them about $30 a day to house those prisoners. The old rate was $22. We've upped it to $25 a day, which cost us $5,327,175. Transfer funds from the county jail subsidy program under 1999, $5,000. And then private prisons, increased funds provide a $2,000 cost of living adjustment for all full-time currently employed correctional officers to maintain salary parity. This includes everybody, staff and all. It's $3,888,000. Under 1910-2, annualized funds for recruitment and retention, $2,967,000. That's only provided for the correctional officers and not the administrative staff. $1912.5, increased funds for a $2,000 salary increase for the correctional officers, $490,000. $490,000. 1912.2, increased funds for the opening of McRae State Prison. The state has purchased the McRae State Prison from the private prisons. They're moving all the female prisoners from Lee Arundel in North Georgia down to McRae State Prison, and that's going to cost $25,657,146. That's estimated to take 6 to 10 months to accomplish that feat. Under Department of Defense, there's no changes. Moving on to the Governor's Office, under the Georgia Emergency Management and Homeland Security, 2765 is analyzed funds for recruitment and retention. This is a true up, $706,841 for a career ladder. We authorized last year, the governor didn't do it, so we're putting it back in. 27.6.6, provide funds for operation and maintenance for GEMA Homeland Security South Building at the Public Safety Training Center. This is the secondary emergency operations center that they've established down in Forsyth in case something would happen and they can't use the primary one. It costs $40,000. 27.6.7, provide funds for service and location of tracking of 16 large generators that they use for emergencies. That's $66,227. Moving on to the Georgia Bureau of Investigation, under 30.2.5, provide funds for maintenance and collaboration of the Georgia Crime Information System, $4,925,000, $4,925,155. What happened with the passage of constitutional carry is people are no longer required to get background checks, permits, so it's the GBI, the GCIC has lost $4,925,156 that have to be replaced to run GCIC. $30.3.8, provide funds and stagger start dates for 14 scientists, new scientists, 2 crime lab assistant managers, 2 crime lab technicians, 2 evidence receiving technicians, 1 IT business analyst, and associated operating expenses in the firearms, chemistry, and toxicology sections to process incoming evidence. We all know there's a backlog in the crime labs. This is to try and fund the areas where they have the largest backload to the cost of $1,497,300, $1,497,368. Regional Investigative Services at 30.5.5. This is another of the $2,000 increase for law enforcement officers to the tune of $1,097,904. 30.5.7, provide funds including $304,700 in one-time funds to upgrade the investigation unit's case management system to a cloud-based system. This is a 1990 system. This new system will consolidate multiple software and managerial systems all in one system. We funded the startup in the amended budget. It's going to cost $110,205. 30.5.7, provide funds including, I just did that. 30.5.8, provide funds for new leads tracking system to increase efficiency and enhancement in technology investigative capabilities. $705,000. Again, we funded the startup in the amended budget. What this does is the software consolidates huge volumes of digital data to relevant items so that investigators can review it. 30.5.9, provide funds to establish and operate a cold case specialty unit. $2,745,149. 1 special agent in charge, 2 assistant special agents in charge, 10 special agents, 2 criminal intelligence analysts, 2 digital forensic investigators, and 2 admin assistants in office space. Throughout Georgia, I think in just Athens, Clark County, we have 40 cold cases dating back to 1972 that have been resolved, and there are hundreds throughout the state. Most of the time, investigators don't have enough time to go back and work on these cases because they have due pending cases. So what this does is establish a unit that can go throughout the state and work on cold cases that need resolution. Moving down to 30.6.5, analyze funds for recruitment and retention, $890,924. This is in the Criminal Justice Coordinating Council, who's administratively attached to the GBI. But last year they got a $5,000 raise. Everybody did. The governor didn't put any money in here. So what the CJCC did was they took the money out of their crime victims fund. So what we're doing is we're putting it back in there. We're making them fiscally sound, $890,924. And then we're providing funds back in 30.6.6 to the Georgia Crime Victims Emergency Fund to make it whole again at $4,566,146. $30.6.7, reduce one-time fund for training grants, taking back $7,500,000. What happened is in last year's budget we provided for a de-escalation training unit at the Georgia Public Safety Training Center. They're going to take over the de-escalation training that the GBI previously had, and we just recently in the amended budget funded 10 vehicles and all the equipment, so they'll take this de-escalation training unit all around the state, go to the local police departments and sheriff's departments, and be able to provide that training on site so they won't have to travel to the Public Safety Training Center. 31.6 Juvenile justice, 31.1. I'm sorry, I skipped one. Important one too. Provide funds under 30.8.1, provide funds for the sexual assault nurse examiners, coordinators, improve access to sane resources for sexual assault centers. $2,525,796. These people are pretty pertinent in sexual assault cases. They have the expertise to make sure all the evidence is collected, and if that doesn't happen, many people who are guilty of sexual assault go free. But under juvenile justice, 31.1.5, increased funds provide for $2,000 salary adjustment for law enforcement officers, $379,940. Again, under Department of Administration, 31.2.5, it's the same thing for $104,230. Secure commitments at the YDC, it's the same thing. Increased funds provided for $2,000 salary increase at $127,766. In secure detention, it's the same thing again, 31.4.5, $127,766. And then we move on to the law department. 33.1.6, provide funds for digital evidence management system, $875,000. This is half. It's storage for gang cases, video evidence for human trafficking. An example is that if you had a gang incident at a Walmart, they have about 30 cameras out in the parking lot. In order to consolidate all that and be able to hold that evidence, they have to have this type of a system. So it's $90,787. 33.1.7, provide funds for a 3-year merit-based retention incentive for attorney positions, $1,624,964. This funds the first year of 3 years. Board of Pardons and Paroles, there's no change. Public Defender Council, and I've explained this before, but what happens with public defenders, typically when we treat public defenders the same as we do district attorneys, whatever monies we give to the district attorneys, we give to the public defenders. Under 37.2.5, utilize existing funds to comply with House Bill 1391. Annualized circuit public defender raised to match the DAs, $1,156,925. 37.2.6, analyze funds for 3 assistant public defenders in the Blue Ridge, Mountain, and South Georgia judicial circuits, $217,743. 37.2.7, increase funds for 3 additional assistant public defender positions for new judgeships, $226,031. 37.2.8, provide funds for 1-step increase and to align the salary scale for assistant public defenders to support recruitment and retention in accordance with the district attorney, $1,907,351. 37.2.9, provide funds for rent expenses for the Regional Alternative Defender Office, $322,953. 37.2.10, provide funds for representation in large multi-defendant cases. These are things like RICO and gang cases. You have 15, 20, 25 defendants. Each one of them is entitled to a public defender. So that's pretty substantial. It comes to $500,000. Department of Public Safety. 39.1.5, increased fund for $2,000 salary adjustment. This is the same thing we've seen in the other areas, $67,200 in aviation. Capitol Police Services, the same thing, $171,360. Department of Administration, the same thing, $20,160. 39.4.5, the same thing, $2,960,160. 39.4.9, they're building a new state patrol post at Jekyll Island. It's bonded, but they need $150,000 for the opening, which is be near the end of fiscal year '24 for furniture, other equipment that's not funded in the bonding package. 39.4.10, provide for the establishment and operation of a Georgia State Patrol satellite post in Buckhead in the city of Atlanta to allow for quicker response to incidents inside and along the northern Atlanta perimeter and afford an additional base of operation for the Nighthawks and the DUI task force. $1,250,000, 20 officers. They're coming out of the Nighthawk crowd, which is a federally funded organization, and they were also going to include the motorcycle unit. Under motor carrier compliance, 39.6.5, this is the $2,000 raise again for all the motor carrier compliance officers, $866,880. Moving on to administratively attached units, 39.8.4 is the Georgia Firefighter Standards and Training, provide $55,000 and utilize $220,000 existing funds for ongoing costs for virtual testing for firefighter certification and training. Moving down to the Public Safety Training Center, 39.10.4, increased funds for the $2,000 salary adjustment that we've seen over and over, $312,015. Provide funds for operations, $628,857. This is for the the costs in ammo, electric bills, water bills, and sewer bills that have all risen, and certainly we all understand that. 39.10.6, provide funds for annual CPR training for dispatchers. Senate Bill 505 and 2022 provided that all dispatchers must have annual CPR training, and that's going to cost $291,908. And last but not least is the Governor's Office of Highway Safety. 39.11.3, reflect an adjustment in 39.11.4, increase funds and match federal funds for one finance position, $28,839, which will also increase their ability to draw down federal funds. And last, 39.11.5, provide funds for travel, $36,253. And that concludes. If we have any questions from the committee members, we have a motion due pass and a second. All in favor signify by saying aye. Aye. All opposed, motion carries. Thank you. I don't know how I missed that same thing. I didn't have it marked.
Do all the members have a copy of the budget? All right, good morning. I'll call this meeting of the Appropriations Committee to order. And Chairman Perkle, if you'll hit your button, you did such a great job kicking us off this morning. I'd love for you to open us up in a follow-up introduction prayer. How about that?
Yes, sir, Mr. Chairman. Pray with me, if you will. Dear Heavenly Father, Lord, I do thank you so much for the blessings that we have of the day. Lord, I pray for each member here. Lord, I pray a hedge of protection around their families as they're away. Lord, I pray that you'll grant us wisdom as we try our best to be good stewards of that which you've given us. And this we ask in your name, Jesus. Amen.
Thank you, Chairman Perkle. Members, before we get started on our business, I just want to say thank you to all of you for the time you put in on the 24 budget. We met before the 23 was totally finished, and the last few days have been long for many of us, and I just want to thank you for the time you put in. That being said, I'm going to turn it over to our secretary and let him take over the meeting.
Thank you, Mr. Chairman. All right, ladies and gentlemen, the subcommittees this morning has had under consideration each of the subcommittee appropriation committees bill, the House Bill 19, and at this point we'll recognize the chairman of the committee to present the bill. Mr. Chairman.
Thank you. Thank you, Mr. Secretary. Well, good morning. We've been in this room for a while. Started to think I was in a judiciary meeting. If you've been watching since 7, you've heard a number of great initiatives that we're able to include in this version of the budget. But our work is not done. We know that there's some priorities that need additional funding, specifically in behavioral health and law enforcement. We'll continue working with our partners in the Senate and with the governor to keep the momentum going and build upon the items funded in the House budget. A few of the highlights are $26.7 million in the employee retirement system to provide an annual one-time benefit check. You know, we just did that in the amended, and this puts that money as a line item for us to address hopefully every year. As you heard in the subcommittees this morning, the House targets additional salary enhancements in DBHDD, forestry, and driver services to address retention in high turnover areas and hard to staff positions. The House was able to add $13 million in targeted salary adjustments to state law enforcement officers across agencies. This $2,000 pay raise is in addition to the $2,000 proposed by the governor. This salary adjustment is intended to increase competitiveness with surrounding states and other law enforcement agencies, and it's to acknowledge the increasing call to duty of our law enforcement. Continuing along the lines of public safety, we've added $1.25 million for a new State Patrol satellite post in the Buckhead area of the city of Atlanta to address crime and promote a faster incident response in the north side of Atlanta. $2.7 million for a new cold case specialty unit in the GBI. $1.4 million for 21 additional positions in the Forensic Science Service Division of GBI to address the backlog of the firearm, chemistry, and toxicology evidence needs processing. To support the victims of crime, the House includes $2.5 million for sexual assault nurse examiner positions at each of the 28 sexual assault centers across the state, and $4.5 million to correct a structural problem in the Crime Victims Emergency Fund to provide state funding for the positions and operating expenses to administer this fund, thus freeing up fees collected to help cover expenses for victims of violent crime. You'll recall that just 2 long days ago, the House and Senate agreed to an additional $8 million in this fund for the amended 23 budget. In economic development, we added $1.5 million in the House budget for the Department of Agriculture to continue the implementation of the Raw Dairy Act, implement funding for the State Agricultural Response Team, who are charged with responding to animal disease outbreaks like avian flu, and provide staffing and operations to administer and enforce soil amendment rules. We added $1.5 million in the forestry program for salary enhancement for foresters. In education, the FY24 budget fully funds the QBE formula, totaling $13.1 billion in state funds. That's the most state funds ever funded to K through 12 education. And this is a big one. We're funding $6.3 million in the Department of Education to cover the cost of breakfast and lunch for reduced price students. And this is expected to provide free breakfast for 32,000 children and free lunch for 64,000 children. And we added an additional $262,000 for communities in schools to recognize the additional county participation and peer affiliate increase. In general government, the House includes $550,000 for a data plan contract for poll pads for the Secretary of State's office for elections, as well as $584,055 to establish the State Election Board as a separate program within the agency, including funding for 2 additional investigators. To address licensure and complaint volume, the budget also includes $191,915 for 2 analysts and a full-time educator for the Georgia Board of Nursing, as well as $308,959 to provide 5 additional analysts to help with other licensing boards. The Department of Driver Services receives over $2.3 million to target high turnover at certain customer service centers. In health, numerous Medicaid rate increases are included in the House budget, further supporting healthcare providers. These include additional support for providers of primary care and OBGYN, home and community-based services, EMS, speech, audiology, and therapy that totals $35 million. The House budget also includes $2.8 million in Medicaid to provide adult coverage for dental services. Only emergency services are currently covered. The House provides substantial additional support for graduate medical education in Georgia, including a total of $5.2 million for residencies and fellowships, $3.1 million for hospitals starting up new residency programs, and $3.4 million to support loan repayment for providers practicing in rural areas and educating future providers. In higher ed, we added $8.2 million in TCSG to implement a one year of a 3-year plan to address the additional funding needs for the high-cost programs of aviation, CDL, and nursing. In lottery, the House supports the integrity of the Zell Miller Scholars. We made an extremely difficult decision more than 10 years ago to differentiate between the award levels. Students who've been working towards the Zell Scholarship deserve to have their hard work acknowledged in a higher payment. The House budget provides the Hope Scholarship at 95% of the Zell amount rather than the full 100% recommended by the governor. In doing so, the House was able to address 2 additional needs not contemplated in the governor's budget. The House version provides an adjustment to the private Hope Zell Scholarship, bringing the award to $3,100 for Zell scholars and making the Hope Private Scholarship 95% of the Zell Private Award. The House budget also redirects $11.9 million in lottery funds to address the increased costs in funding the employer share for state health benefit plan for public pre-K teachers. As a result of increased employer contribution implemented in January of this year to shore up the plan, school systems that provide pre-K will receive an increase in their state health benefit billings for pre-K teachers without an associated appropriation to cover that expense. This House version provides funding toward that expense. Human Services. Building on the momentum of the last budget cycle of adding 513 new now comp waivers for individuals with intellectual and developmental disabilities, the House annualizes those waiver slots, agrees with the governor's recommendation to add 250 waivers in FY24, and adds 125 slots and administrative support for a total of 375 new waivers in 24, and a total increase in funding of $19 million. The House builds upon the governor's recommendation and provides $29 million to support the establishment of behavioral health crisis centers in Augusta, Dublin, Fulton County, and Rome. $10.1 million is provided to increase salaries for state psychiatric hospital staff to bring them closer to market salary. Last year we made a huge investment in staff, and we know that that's translated into the department being able to fill and retain critical positions to bring beds back online. This adds to that momentum. We also acknowledge the need to fund the provider rate study and look forward to working with the governor and the Senate to develop a plan and funding for implementation. And in the transportation budget, there's $20.1 million is included for local maintenance and improvement grants, LMIG, to phase in the percent of motor fuel funds appropriated to LMIG from 10% to 15% over a 5-year period. LMIG is currently funded at $200 million, and this could increase to $300 million in the next few years to address maintenance on local roads. In closing, again, I want to thank all the subcommittees and their chairmen, and especially the House Budget and Research Office and Christine Murdoch, their director. They've worked hard into the wee hours of the morning for several nights and all weekend to bring this to you. We looked at many needs, and unfortunately, we can't fill them all. But I look forward to working with the governor and the Senate on other possibilities to get them funded. Mr. Secretary, I am available for questions.
Well, thank you, Mr. Chairman, for explanation of a great 24 budget and all the work that has been put into that with you and the subcommittee chairs and members of the committee. Are there any questions from members of the committee at this time? Mr. Dubnik, no questions. I recognize you, sir.
Thank you, Mr. Secretary. I move that House Bill 19 do pass by committee substitute.
We have a motion and a second that House Bill 19 do pass by committee substitute. Is there any discussion? All those in favor say aye. Aye. Any opposed, like sign. Motion carries. The budget has been adopted by the full committee.
You can adjourn.
Any other comments, Mr. Chairman? We are adjourned.
The meeting.